Welcome to the NREMT Long Bone Immobilization Station. Your candidate instructions have been given to you. You may now take 2 minutes to look over your equipment.
Okay. I have padded board splints, BSI, some sheets, towels, extra cravats for padding should I need it. I have a bunch of cravats, and I am all set.
Okay. The scene survey and primary survey have been completed, and the suspected closed non-angulated fracture of the right tibia is discovered during the secondary survey. Continued assessment of the patient's airway, breathing, and central circulation is not necessary in this skill. You may use any equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
I do not.
You may begin.
Okay, just making sure that my scene is safe.
Your scene is safe.
And I have my BSI on. Just going to approach my patient, introduce myself. Sir, my name is Kyle. I'm here to help you. And I understand, just making sure this is the injured extremity, the right side.
Correct.
Sir, can you just sort of help hold your leg in place for manual stabilization? And I'm going to assess PMS in the injured extremity. So checking pulse.
Fetal pulse is present.
Okay. Sir, can you feel this?
I can.
And can you push down on my hand and push up on my hand?
PMS is intact.
Okay. So I'm going to get my padded board splints, measure on the unaffected extremity. Just put those in place for right now. And I'm going to take my cravats. So I'm going to put 2 above the knee, 2 below the knee, making sure not to cover the joint. And I'm going to use the space underneath the knee as a natural void to help slide these into place. Similarly, going to use the space below the ankle as a natural void. And just have one final one that I had tied together as the ankle hitch. We'll just slide in place. I'm going to take my board splints, making sure the foam is on the inside. Put those in position. I'm going to tie the knots against the side of the board. I'm just going to go back down one more time just to make sure they're all tight. lastly, make sure the foot is secured in a position to function. Now that the leg is secured, I'm going to double check, sure that I have PMS.
Pulse is present.
Sir, can you feel this?
I can.
Can you push up on my hand? Push down on my hand?
PMS is intact.
Okay.
Is there anything else you'd like to do for this patient?
No, I'm complete at this station.
Instructions to the psychomotor skills candidate for long bone immobilization. This skill is designed to evaluate your ability to properly immobilize a closed, non-angulated suspected long bone fracture. You are required to treat only the specific isolated injury. The scene survey and primary survey have been completed, and a suspected closed, non-angulated fracture of the left radius ulna is discovered during the secondary survey. Continued assessment of the patient's airway, breathing, and central circulation is not necessary in this skill. You may use any equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
No.
Long bone immobilization. The candidate takes or verbalizes appropriate body substance isolation precautions.
Scene safety BSI.
The candidate then directs the application of manual stabilization of the injury.
I'm going to have my partner manually stabilize the injury.
The candidate assesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for a pulse. Feel a pulse. Do you feel me touching you?
Yes.
Can you squeeze my fingers?
Yes.
The examiner will acknowledge motor, sensory, and circulatory functions are present and normal. The candidate then measures the splint. The candidate applies the splint.
Alright, I'm going to have you hold on to this gauze. And then, if you can reach around to the edge of the board. Alright, I'm going to tuck this under your thumb.
The candidate immobilizes the joint above the injury site and the joint below the injury site. The candidate secures the entire injured extremity, immobilizing the hand in the position of function. candidate reassesses distal motor, sensory, and circulatory functions in the injured extremity.
Checking for pulse. Feel pulse. Can you feel me touching you?
Yes.
Can you wiggle your fingers?
Yes.
The examiner acknowledges motor, sensory, and circulatory functions are present and normal.